Hello, today is Friday, March 26th of 2021. My name is Evan Solis. I'm interviewing Senator Tony Vargas for the Voces Oral History Center at the University of Texas at Austin. Please know, Senator Vargas, that this interview will be placed in the Nettie Lee Benson Latin American Collection at UT Austin. If there's anything you do not wish to answer or talk about, I will honor your wishes. Also, if there's something you want to talk about, please bring it up and we'll talk about it. Because we are not conducting this interview in person, I need to record you consenting. So I'll ask you a series of 5 questions. Please say, yes, I agree, or no, I do not agree after each one. There are 3 questions we need to make sure you agree to before we go on. 1, Voces wishes to archive your interview along with any other photographs and other documentation at the Benson Library at UT Austin. We will retain copyright of the interview and any other materials you donate to Voces. Do you give Voces consent to archive your interview and your materials at the Benson Library?
Yes.
Okay. Do you grant Voces copyright over the interview and any material you provide?
Yes.
Do you agree to allow us to post this interview on the internet where it may be viewed by people around the world?
Yes.
Okay, thank you. So 2 more questions. We have many questions in a pre-interview form that you and I have just filled out. We use that information to help in research. The entire form is kept in a secure Voces server. Before we send it to the Benson, we would have stripped out any contact information for yourself or your family members, so that will never be part of your public file. Your public file will only be accessible at the Benson Library. Do you wish for us to share the rest of your interview, that is, that pre-interview form, in your public file available to researchers at the Benson?
Yes.
Okay, thank you. And last question. On occasion, Voces receives requests from journalists who wish to contact our interview subjects. We only deal with legitimate news outlets. Do you give consent for us to share your phone numbers or your email with journalists?
Yes.
Okay, fantastic. All right, well, thank you, Senator. That being done, we can get right into it. As I mentioned, this is for our Voices of a Pandemic project, so we're very interested in hearing you talk about your experiences specifically related to the pandemic. Before we get into that, though, I do just want to ask you to please give us some background on you, so who you are, where you're from, and what you do.
Yeah, happy to. My name is Senator Tony Vargas. I'm a state senator in Omaha, Nebraska, in the Nebraska legislature. I'm one of 49 state senators representing the great state of Nebraska. I've been an elected official for the last 8 years, and most recently I've been a state senator going on 5 years here, and I serve as one of 2 Latino legislators and the youngest Latino legislator in the state.
So before you were a senator, what elected position did you hold?
Before I was a senator, I was a school board member. I was appointed to the Omaha Public Schools Board of Education, where I served the remainder of somebody that resigned from their elected term, a 4-year term. I served about three years and change of their term, and that's how I first got into elected office.
So I understand, and please, if I say anything that's incorrect, please correct me. I understand you were the first elected Hispanic official in the legislature at the time there in Nebraska.
I was the first outright elected Latino legislator. There was an appointed Latino legislator out in Grand Island, Nebraska, that was eventually elected, but I'm the first that was outright elected.
So, if I understand correctly, the demographic makeup of Nebraska Latinos make up maybe about 10-11% of the population. So I'm wondering how you, the son of Peruvian immigrants, end up becoming the first elected Latino official in Nebraska. Can you walk us through? I'm sure when you can go into as much detail as you'd like. How did that process begin, and how did you end up where you are?
It's a longer story than we have, but I could tell you this. I never really thought about politics before me being a politician. It's not something that I was raised talking about. I never identified as a Democrat, Republican, Independent, or anything. Neither did my family. My parents did. However, being born and raised in New York, and upon moving to Omaha, Nebraska, so that my wife can go to law school here, I was in a place that wasn't my home, but had become my home, where I was seeing many of the same issues and that are affecting communities, specifically in the world of education. My profession for most of my career has been as an education consultant, either as a teacher, training teachers, working with superintendents, training superintendents, working on policy and advocacy. And I've done so much work in New York, and now I'm in Omaha. And I had done work across the country as well, but not in my own backyard. And I'd been living here for about a year in Omaha, and I decided I wanted to get more involved. And happens just by chance or opportunity, I don't know which one, but there was somebody that resigned, and they asked, we're looking for somebody to be a school board member for the most diverse school district in the state of Nebraska. One of 9 school board members, the largest school district in the state, 60,000 kids, nearly 90 schools, 100 plus languages spoken in the district. And the community that I would represent is also the largest Latino serving district. And they were asking for people that care about education, care about equity, care about making sure that we're improving the educational outcomes for kids, better communication and reach to families, making sure that more individuals have brighter opportunities once they have a degree. And I've been fighting for most of my career, my young career, but my career, to then do just that. And now there's a position to do that. And so I applied, and I got selected. Little did I know it was a political position and that it's an elected official. And some people view this as elected official as purely about politics. There's 2 sides to the coin. You're a Democrat or a Republican, and there's right and wrong in terms of policies, and I don't view things that way. And so I became the only Latino elected official on that school board, representing the largest Latino serving district in the Omaha, and that's how I really got into politics, and that's how it's a strange place to be in my career at that time. I was 27, 28 to be appointed, but it felt really important to me that I was taking responsibility for the role that I was put in, because so many of the kids in my community were Latino, or were first generation or 4th generation. They have a connection to an ethnicity with which I identify with, and they don't see people that look like them in seats where I was sitting in. And I realized that there's a really significant responsibility I have to do good in this position, and also that I'm carrying a lot of that identity. And I really I realized I loved doing this work. It's difficult, it's hard, it requires somebody that's compassionate, that's willing to listen, that's also willing to act on that compassion and utilize, make things happen for the right reasons. And I decided I want to do more. And that's how I ran for the state Senate in 2016. And I'm not from this state, but I decided to run because, despite not being from here, I understood and I could see the faces of my community, young professionals. There was young, immigrant families. There were people from 5 generations ago, immigrants that have been here, from the Italians to the Polish to the Czech, all the way to the Mexicans and Latin American individuals that are here just this recent generation, many of them. I had an identity that I shared with them. And I realized that most of the issues that were facing these communities, my community, was beyond education, housing, good jobs, better healthcare, people getting a fair shot, more just and equitable system for people, were just not how people describe the world, especially in their own backyard. And so I decided to run for the state Senate. I didn't fully realize how political politics is, but I wasn't getting into it because of politics. I was getting into it because I don't know, my parents reminded me that politics doesn't have to be about politics. And so I became the first outright elected Latino state senator. And at that time, the only Latino state senator in the Nebraska legislature in 2016. And it has been a heavy burden to carry, but it is something that I feel a sense of responsibility and a sense of dedication to the 10% and all the other Latinos in the community that don't feel like they have a voice, and also responsibility that other people that may not understand different identities, like my Latino identity or being a person of color or being a Hispanic male, Latino male, that they get a better understanding of what life is like from my eyes. Yeah.
So you mentioned some of the these big issues that your community faces, and these problems having to do with education, housing. So if you reflect on before COVID, before this past year when COVID sort of became the thing that was at the forefront of everyone's mind, what were you focused on regarding your work as a senator? What projects or legislation were you really pushing or hoping to get passed to serve your community?
I'm a bit of an idealist. I'm a pragmatic idealist, is what I tell people. So when I got elected, I'm elected and I serve in the Nebraska legislature, the country's only nonpartisan unicameral, which means it's one house, 49 senators represent all the legislative lawmaking. It's also nonpartisan. There are no party systems. There's no majority minority leader, and largely felt like there are things that I can and should try to do, and I'm going to do everything I can to see them through. So we've worked on a lot of different issues because the issues impacting my community, specifically our lower income community, more diverse community, are shared issues we see across the country. I was seeing housing insecurity as an issue, the health of housing, a low housing stock, segregated communities. So housing, equity was a big issue. Justice reform, specifically juvenile justice, all the way up to our corrections system, everything kind of in between. So working on a lot of different legislation in those areas because I wanted to, basically, we need to work on the entire continuation of the justice system to make sure we're evaluating how fair and equitable it is, but also to make sure we're not bottlenecking things. We have an overcrowding problem in my state. We're one of the most overcrowded prison populations in the country. The solution's not building more prisons. The solution has to be some level of reform in tandem with any sort of creation of new beds, new community corrections beds. And so I was working on how do we get as sort of upstream that we can in the juvenile justice system as that. I worked on a lot of education issues, all the way from early ed to higher ed. That's better transparency, better outcomes for the education system, all the way to college affordability for low-income students. I've worked on issues of worker safety. Under normal circumstances, I've also been working on worker safety even amidst the COVID-19 pandemic. And I worked on job creation, small business support, and with the intention of trying to make, look at regulations in a different way to make it somewhat easier for small businesses to not just thrive, to survive in most instances. And healthcare access and equity. I serve on the appropriations committee. I've done a significant amount to improve our funding to our federally qualified health centers, which they are supporting our uninsured population across this country. They are serving a population in my community, 50% of the people that go to the FQHC here are uninsured. They don't ask. They treat. They're not asking questions. They treat people, and so we kind of worked all across the gamut because that's what I committed to doing when I first ran for election. I knocked on 36,000 doors, and I told people that if there was one solution that solved the problems to a community, I would be lying to the community, and that's not what I'm going to do. We have to do a better job at everything as much as we possibly can, and then consistently look at, innovation as doing things better, not always the bright and shiny objects. And so we're trying to do things. I've been trying to push and do things better because all those things impact my community because of the way equity works. Healthcare access is less equitable for my community. And not only Latinos, my entire community. I have a lower income population, and they have less healthcare access over their lifetime. They interact with it less. Housing, there's fewer housing. There's an unhealthier housing stock. More affordable homes, but that don't maintain their value. Fewer housing options. Educational outcomes and attainment in my community is lower, not just on competency and efficiency and proficiency scores, but graduation rates in comparison to other public schools in the sector in Omaha. So across the board, equity was a problem. And so I've been trying to work on equity in all those different areas.
Yeah, that's a good segue to talking about COVID and the impact of COVID, and especially the impact of COVID on communities of color and Latino communities. Before we talk about that aspect of COVID, though, I do want to ask you about your personal experience with COVID. I understand that fairly early on in the pandemic, you were struck by a personal tragedy and the fact that you lost your father. Several members of your family got sick. Could you talk about that experience? How was it that your family members got infected with COVID? What was that like for you to deal with that process? And just walk us through, please, what that was like.
Yeah. It's interesting. And so it's 2019, the end of 2019. I was actually working with our local public health departments to put together a bill that would add more funding to our public health departments. And part of the reason was I always knew that public health probably does a lot more for communities, lower income communities and communities of color, because they focus on preventative community health. And at the same time that we're putting together this bill, I just started hearing about COVID-19, across, in other countries spreading or starting, and it was so far away at that time. It was just this November, December. It was very early. But the thought had crossed my mind that we may not be well equipped to react to this pandemic and to this virus if things like public health, which we rely on to prevent these things from happening. Public health represents 2 to 3% of all of our spending on healthcare in this country. And I was afraid that might come, and there was really sort of no rhyme or reason yet. It wasn't on many people's radar. Even our public health departments were just monitoring it. We're in the middle of the country. We thought maybe at the worst it would be maybe a coast. But fast forward to January and February, we were watching and sort of monitoring the situation. But there was still this in the back of our mind that it wasn't going to hit the United States like it was hitting. We were just still seeing it maybe hit other countries close to us, but not nearly as much. Or that it was, and at that time I felt like it was being sort of somewhat downplayed by the presidency and the administration, which didn't help with what eventually happened. So, my parents actually were in Peru in early February, end of January, early February, visiting family. They came back to New York, and I'm in session, where session starts in January 2020, and I'm in session. But they came here because my daughter was turning 1. Her birthday was on February 14th, on Valentine's Day, and my parents wanted to be here, and so they flew out here. And there was no confirmed cases at that time anywhere in the Midwest. It was not a thing yet. And, but I remember thinking how happy I was because my father had three boys, myself included, and he didn't have a daughter. He has some grandchildren, other granddaughters, but this is my first, and he was just really smitten with my daughter. They just got along so well. She just started walking. She wanted to hold his hand. We had a beautiful time together for my daughter Ava's birthday, her first birthday, and it was beautiful. And this is probably the quickest 4 weeks, quickest month and a half. That month and a half flew. My parents left. We had a beautiful time together, and they left. And over the next 3 weeks, COVID-19 began to spread across the East Coast and amidst the Midwest. There were travel advisories immediately put into place, and I was seeing how quickly it was spreading. And bear in mind, we're in the Midwest, so it's hitting us later. We put a pause on the legislative session in mid-March, right? The first week and a half into March, because of everything going on across the country. So we put a pause, and everybody went home, and we were at home. And I was worried at that time. I was worried because of everything I told you. All my campaign promises felt less like campaign promises. They felt like I always understood that these inequities existed in all these sectors normally. And then immediately when the pandemic came around, my first fear was lower income and working families and people of color are going to get devastated by this. And those of us that have been part of have been looking at policy for so long know that the inequities existed beforehand. And now, because of the way the system operates, if a pandemic hits the general population, it is just going to inevitably hurt these communities more. And it's hard to calculate, but you knew it was going to happen. It was the most logical thing to me. And I remember then starting to call my friends in the community about our food processing workers, our construction community in Nebraska, my own backyard, because I have the largest Latino serving community in the state is in my district. We have the eastern part of Omaha, which is where the most lowest income community was. And I started hearing about stories from friends in other communities. I was plugged into my friends that work in public health across the country, and they're telling me about the front lines of what's happening. And I'm watching the news, and I'm also having conversations with my own parents, which are difficult because they didn't think it was that real at first. They watch the news, and some people say it's a caution, but then they also watch, the president give addresses and saying everything is going to be generally, not that it's like fine, but we're prepared, it's okay. Like, trying to pacify concerns or downplay a virus really fed into the psyche and the rationale of my parents and other family members and people around me that I loved. That when I felt like I was sounding the alarm for my parents, I asked them to stop working. My other brothers asked them to stop working too. It took them a couple of weeks, but they finally stopped working. By the time they stopped working, it was March 15th, right around the same time that I took a break from the legislature. We recessed. And around that time was when my parents started feeling sick. And I remember talking to them over the phone. And when they told me they're feeling sick, my stomach just dropped, because I'm like, statistically, with the way the inequities already exist in the system, I was scared that they had COVID-19. I was scared that they just got this virus. My dad works as a machinist, and he's, and he's working with his hands. He's largely standing up most of the day. He's helping other people too. He's a shop steward, and my mom works at a bank. She does customer service, helping people. And I was like, they're constantly exposed to people and they have no choice but to keep working. They have to keep working. And the only reason they came home was because they were sick. They thought it was just a regular infection, like a sinus infection. And they contacted their doctor, and their doctor gave them, that time the doctor called my mom and said, you can get like a sinus infection, like a Z-Pack, and we'll see how it goes. And this was all virtual because the doctors stopped doing in-person visits. My father called too. He was sick too. And they gave him a Z-Pack too. But in the back of my mind, me and my brothers told them, I was like, we need you to get tested as soon as possible. And then when they got tested, my mom called me, my brother called me, my oldest brother called me, and my mom called me. My oldest brother called me and said, you have to call mom. And I was like, what? And she's like, you have to call them right now. And I called my mom, and then my mom said, and they had gotten the test on a Wednesday and it was a Saturday. And that Saturday, they got the test results back, and my mom is on the line with me now, and she starts crying because she tested positive. And the worst part about this is it's not just my mom, it's my dad too. When they went on the test on the Wednesday, my mom was the only one that was set up to go get a test through the doctor. My dad was sort of 2 weeks behind in terms of going to the doctor, so he wasn't up yet. I just told my mom, I was like, you need to take my dad with you. You need to take him with you and tell him he's spending every waking moment with you. So if you're going to test me, you got to test my husband. Because I knew that there was no way my dad would take it seriously unless he actually got a test that told him he had COVID-19. It didn't matter if he felt the same symptoms, he wouldn't believe it. And now we have Saturday, and he's telling me they both have COVID-19, and I just froze. And when I freeze, I get into sort of, I don't actually freeze. I get into a what's next mode. What do we do next? I immediately called my brothers and talked to my family members, my immediate family, and it's like, this is what we have to do. Like, we're going to get him an appointment. I talked to my dad. I'm like, I'm going to get you a doctor's appointment. We're going to get a chest x-ray. We're going to see how bad it is. It's like, I feel fine. And I said, no, we have to do everything we possibly can. You do not know how quickly this can impact you. I get these briefings from my own state on what they're learning. We have an infectious disease center here in University of Nebraska. It's a world-renowned infectious disease experts. And I'm getting these briefings telling me how bad it can be. And I'm having to be Chicken Little in my and with my parents about how bad this is. And I'm doing this from Omaha. Over the next 48 hours, my dad has contacted everybody he's been in touch with the last 2 weeks. My mom has too. I set them up on a regimen of evaluating their symptoms every couple of hours, each other's symptoms, so that we can test severity, shortness of breath, breathing capacity, their fever, all the symptoms that we've been seeing, monitoring it. My dad was worse than my mom at this time, and he was trying to play through the pain. And so we finally tried to get him an appointment, and we couldn't get it for that same Saturday. But we were able to get it for Monday morning, first thing. And so I didn't realize how quickly it was going to hit him. Sunday was a terrible, terrible day for my dad. He's normally a very relatively calm, somewhat stoic guy, and wouldn't show that he has any pain or weakness, because that's just not who he is. And he was just in pain and kept telling me that over the phone. My mom kept telling me he won't move, he can't move. He's he can barely catch a breath. So I set him up for Monday morning, what he needed to do, how he needed to get there to get this test. And I was worried. And Monday morning rolls around, he goes to the doctor, and he gets the chest x-ray, and he calls me right afterwards. And my dad tells me in the most scared voice I've ever heard in my entire life that he's ever spoken to me, that the doctor told me I have to go to the hospital right away, and that the chest x-ray shows significant inflammation to the point that he needs to be in a hospital immediately. And I told my dad, you need to go. And I had a hard time processing it, because the first thing I wanted to do was cry. First thing I wanted to do was be upset and be with him. But all I can think of was, he needs to be told what to do. So I told my dad, you have to go home now, and then my mom or somebody else can drive you. Mom can drive you. He wasn't even able to drive. Swerved off the road on his way home. He lost his breath. Finally made it home. My mom was not herself and wasn't handling this well, and she was sick herself, and took him to the hospital. And I said, "Ma, when you get there, you're not going to be able to be with him." And she's like, "But I have to." And I was like, "You may not be. They may not let you actually be with him. You may, because of the rules." And she just couldn't understand why. And I tried to prepare her for the worst. And my brothers too. One has 3 kids, young kids at home, him and his wife, and the other one, my oldest brother, has 3 kids as well, and none of them were sick at this time. But I just told him, I was like, he has to go to the hospital. My brothers understood, and my dad got admitted on that Monday morning. And it was a terrible 24 hours from there. He got admitted, and they said, we're going to do a chest x-ray and check and see how he's doing. But he needs to be in the ice. He needs to be in the hospital right now, in the emergency room, just to make sure. I'm going to change the volume here real quick.
Can you hear me? Yeah, he needs to be in the hospital, and we're going to admit him. We're going to make all these tests and put him on some oxygen so he can breathe better, and assess how much he's taking in. And he said, okay. Everybody said, okay. And my mom got checked and evaluated too, because even though it wasn't his worst, I still wanted to make sure. And my mom was eventually discharged later that day. Her oxygen capacity was better, wasn't great, but she can manage it at home, they said. But she still needed to watch out. At that time, nobody could help her because she went home, but my dad wasn't better. They said they had to keep him overnight to test him and make sure and assess his sort of lung capacity and his breathing and all these other metrics. And we all said, okay. At that time, I think I called all the doctors I could, because I was like, I want to get updates, 2, 3 times a day. I'm going to tell my entire family, and I want to know what's happening with him, because we can't lose my dad. And I was just thinking of the worst. I didn't know how else to think about it. Keep in mind, all this is happening at the same time that people in my own backyard in my state are starting to be cases, just starting at that time, like a few. And that Monday, my father stayed over in the hospital, and Monday night, he slept. And on Tuesday morning, I got a call from the attending physician who was giving me an update on him. And it started off calm, and he said, here are the updates, here's how he's doing. And then the attending told me, I'm sorry, but I have to go. And I said, what? And he said, your father is an AFib. And and I will call you back immediately. And I called my brothers, and everybody immediately just didn't know how to handle it. That he basically, his heart stopped, and and they're like, we just were talking to him. It was 24 hours ago. We were talking to him on the phone. It wasn't great, but he was okay. And 6 minutes later, they called me back, and they said, your father had a heart attack, and his heart stopped, and we needed to bring him back. And they did, but he wasn't breathing. He wasn't getting oxygen. And the only way that they could maintain the oxygen levels and keep him breathing was to put him on a ventilator. Otherwise, he would pass. And they put him on a ventilator immediately. And so he was stabilized. And from that day forward, it was 29 days of my father on a ventilator in an ICU, Stony Brook Hospital in Long Island, New York. And the worst 29 days of our family's life. Hands down, just, for a family that has a lot of faith, we lost a lot of that faith because we had hope, prayers that he would get better, and then he didn't. He'd get better on a day, and then it would be worse. Better the next day, worse. He would, his oxygen levels would go slightly up, and then they would plummet the next day. One day there was a little bit of hope on his CO2 levels were going down, which was a good thing. But then the next day, his lung starts to collapse. Then his CO2 levels go back up again to 10 times the normal rate. And then they have to relieve pressure in his lung. Then, he can't take any food anymore. And he's basically living off an IV. And this entire 29 days, it feels like a period of time where it feels like a nightmare. It's a nightmare. Because I had so much hope. We all had so much hope. And I wanted to believe that he can be okay. I'd heard so many stories of some people that had gotten out of this situation. I was like, no, he's going to be okay. Like, we caught it early enough. It's going to be okay. And it wasn't. And, my family's never been the same. We are wounded. Everybody's wounded. My father passed away on April 29th in the early morning. And I flew to New York the days before he passed to be there with my family and to be by his side. I stayed in the hospital for about a couple nights. I was in the room with him. I just made a decision. I was like, I might get COVID-19 because I'm sitting next to my dad holding his hand with every single piece of, I had 3 masks. I had masks on. I had a face shield. I had several different layers, but I was in a room, in an anti-pressure room, standing by his side, holding his hand with a rosary in my other hand and trying to pray with him. And just like my mom was, just like my brothers were the day before. And we were doing this because we hoped something would change, and it didn't. And I was almost certain I also got COVID-19. Keep in mind, during this time, my mom had COVID-19 and was sick. She couldn't come in and really visit. She visited once for about an hour to say goodbye, not to have hope, but to say goodbye. My oldest brother, Gene, was never able to fully say goodbye because he had COVID-19. They wouldn't let him in. He was symptomatic. So I felt an obligation to stay there as long as I possibly could with him, because certain family members couldn't do that. So this is really, it was really early on. There was tens of thousands of people, I think 20,000, 25,000 people that had been accounted as dead from COVID-19 at that time. It was still pretty early on. And it still seems like it was yesterday. It's just still a nightmare, even every time I talk about it. This is a terrible pandemic, but it's more terrible because every single person that was lost is a real person to somebody. And I just don't think he had to die. I truly believe that. And we're just trying to keep it together. My family and I are trying to keep hopeful for all the loved ones in our life, because it's what he probably would have wanted.
Is your mother still in New York? What has the last year been like for her since your father passed?
My mother is in New York, and she is the strongest person I know. This has very much changed her perspective on life, in some ways for the better, in some ways for the worse. She's trying to learn what it's like to be on her own. It would have been her 50th wedding anniversary, this coming February. That just passed. It would have been. They weren't retired yet. They were going to retire this next year. So it's hard for her. It's hard as losing a companion. I've only been married for going on 5 years now. It's going to be 5 years this year with my wife. If I ever lost my wife, I don't know what I would do. And that's your partner and everything. And it's also the person that knows you the best, whether you like that or not. It's the person that knows you the best. And so my mom is, luckily, I have an amazing family, and my 2 older brothers are there to be there with my mom and be a support to her. Otherwise, I think it would be even harder than it was this last year. But luckily, she did recover from COVID-19. But the lingering effects of it are still there. We're still watchful of it. She's not the same. I don't think anybody in my family that contracted COVID-19 is the same in any way, shape, or form.
Do you think that that you have been able to grieve sufficient, or I don't know if sufficiently is the term, but appropriately, considering the isolation, the fact that you've got this job where thousands of people are depending on you, and you have to get back to the session, and everything that's happening in your own state under your purview? Do you feel like you've been able to grieve as you would want?
Yes and no. I mean, but largely the answer is probably no. And part of it is grieving feels like a long-term process, like as if it doesn't feel like it's something you do and you can check it off a list. And because I think I view it that way, I'm like, no, I haven't really been able to do it. Um, I also haven't been able to do it because I feel like amidst everything happening with my father, during that time is when it really hit my community. During March and April was when Nebraska got hit for the first time. And the Latino community, lower income families, working people were the ones that were getting COVID-19. The zip code I'd live in, the zip codes in my community were some of the highest zip codes in the state. And I just kept thinking it's like my parents that are working, that are trying to survive, and these individuals that I care about and love, that I represent, could face the same fate as my father. I remember having calls. I remember even on the days that I was out, by the hospital where my dad was, days before he passed, I was on calls in between trying to figure out how we can do more in the community, direct relief payments to people, information about COVID testing, getting COVID testing even available in the community because we weren't able to get it in the community yet. Information about masking, about social distancing, all the things, making sure things are happening in Spanish language, which weren't at that time. Nothing was. Because I was so afraid that every minute, every hour, every day could be a life or a hospitalization like my dad that could have been averted. There's part of me that doesn't want to even say I fully grieve, because the loss of my dad, I don't want it to be without some resolution, and I can't get him back. My family can't get him back. So the resolution here is we have to save more people. Like, other people have to be aware of what changes we can make so that they don't have to go through this. I don't know how else other way to grieve. Sometimes in ways I think grieving made me feel a little selfish, because then I don't have the privilege of being selfish. I don't believe I signed up for that. I believe I signed up for being an elected official, which means that the public wants me to be a steadier hand amidst the pandemic. Whether or not I'm even ready to be that steady hand or to be that advocate, it's my responsibility. And the minute that I let some of the emotion overly consume me, I may not be able to be that steady hand in the same way that I really wanted to. So grieving is now I consider it to be a lifelong process. I grieve by talking to people about my dad's death. I grieve by taking action on things, by not let things sit that could be changed, and spending more time at this time with my family that I can, in ways that I didn't before, virtually at this point. But yeah, I mean, it's I was I remember talking to my wife, and I told her I'm going to tell our community what's going on in our life. I don't have a good poker face. I can't go out there and tell people you should get tested, or we need better testing in our community. Like, we need to social distance. We need better measures to protect people. I can't do that without people knowing what's going on in my life. I would feel disingenuous. So I told everybody what was happening in my life. I told them my father was in the hospital. I told them, and I really fundamentally believed he would get better. I wanted it to be a story of hope. I wanted it to be a story of that we can do things differently, and look, we can persevere. The fact that he passed away, and not only did my family, it was a blow to my entire family. It was all felt like a blow to the community and to the state, because now I'm sharing with them that my dad died of this, and how can we have as much hope? I had to sort of pull a hope out of just being idealistic. But so my community went through a lot of this journey with me, because not everybody had a loved one at that time that was hospitalized or passed away from it. And not that they should, to know what it feels like or to empathize. It's not necessary, but they felt it with my dad, and I felt like it was my responsibility to share it with the community. And still, even to this day, I still do, because we're not out of this yet.
So what has that been like, your role as a public advocate, as an elected official, as a servant for this community? Because it almost seems as if after this tragedy that you experienced with your father's passing, that it is compounded by these tragedies that is happening in your own backyard, right? Where at one point, 60% of the COVID cases in Nebraska are Latinos. You're advocating for these meatpacking workers, but are not being met with, you're not finding success in the legislature with the bill that you want to pass in that moment. Nebraska doesn't pass a mask mandate. They don't put a shelter in place order. It almost seems like you're fighting this really uphill battle. So I'm wondering, just what were you able to do, in that position, in the position that you were in, that was effective? Where were you able to find the spaces to serve your community despite perhaps opposition at the level of your legislature?
I don't think as lawmakers or as elected officials, things are ever easy, even during normal times. And I also think that the accountability that we have to the people is unique and can be really difficult to carry. And amidst this happening, it felt even worse, because we continue to run into roadblocks. We continue to run into non-belief that this was even an issue. People telling me it's not a big deal. I remember when my dad was hospitalized, I was, I would be, online, and somebody would say something like, it's not that big of a deal. Like, it just happened to your dad. And people would find ways to minimize it. And that was represented in other walks of life, not wanting to put a mask mandate, even though masks would largely slow down spread, or not putting in better protections for workers in general, and meatpacking plant workers, not putting in more resources into certain communities. And you're right. It was hard. It was gut wrenching. I never really fully got to demonstrate how gut wrenching it was or how difficult it was, partly because I don't think I was ever in a place where I can demonstrate how frustrating it really was and is, to face that those challenges, and most of those challenges driven by mindsets, like just people's belief about public health and about science and about what could or could not be done to save people, apathy, misinformation, like those things were infuriating. And I didn't feel like I was ever in a capacity to be nearly as infuriated, but I was in a capacity to utilize that to drive solidarity and people's voices, which helped to actually accomplish more things. We were able to get more resources to our communities because I was using the voice and representing other people's voices. We were able to set up testing sites in my community quickly, and free, where it was taking longer in other communities. We were able to then set up additional resources for our community health centers in our area, more free masks, more free information, bilingual community events. I was leading them and starting them, and then people started jumping on and doing their own, and states finally started doing bilingual presentations about a month and a half into this. And part of it was because of the pressure that I was putting and doing it on my own. I was on Spanish language radio, hablando en español sobre esta pandemia, and talking about the pandemic and everything that we needed to do differently and sounding the alarm. It was not the most popular thing because some people in my own community viewed it as you're being like a boy, basically like the sky is falling. I was saying this in March when we were still getting mixed signals. And this is, again, the Midwest, it wasn't the coasts. But I felt like it was my responsibility. And because I did that, I pushed the envelope on taking it more urgent. And we were able to get more of the resources, testing, communications, and some better protections in place for certain communities at a larger rate. And I'm happy we were able to get to do that. But in the back of my mind, I'm still thinking about all the things I wasn't able to do because of other people's lack of urgency and lack of decision-making or sound decision-making. So I take what I utilize. I've been able to drive on what we could do, to drive urgency, to take action, and then hopefully try to continue making changes in other ways. Right now it's vaccines, right? It's trying to get vaccines out distributed. It's still trying to get education out distributed. It's still talking about how we need to be on notice because we're not out of this yet. So yeah.
What has the vaccine distribution been like in your area? Have those same inequities that existed before and that we've seen play out, is that happening in the distribution process as well? And what tools are available to you to make sure that your community gets access to these vaccines?
Well, the first is we're not where we need to be yet, but I think Nebraska is actually doing a pretty decent job of our vaccinated population. I know we're at a minimum, at least at 12, 13% and growing. That was weeks ago. And, you know, I think really early on, because of so much of the sounding the alarm by me and many others about equity, there's been dedicated resources to different communities. Now the main barrier actually is people accepting the vaccine and saying they want it. And that's been a barrier. You know, I've been trying, and I hopefully have convinced, I mean, I just believe in my heart that I've convinced people to then be more open to the idea of taking the vaccine. I've been part of a vaccine trial since last year. I talked to my wife and I said, I'm going to take part in it because they don't have enough people of color. And I'm going to do it because maybe if people see me taking part in the vaccine trial, eventually when we get to the vaccines, people will be less worried that it's okay, and they'll know it's safer than what they think in their mind. And I think it's helped, and I'm continuing to help get the word out. I'm thankful for all the community organizations that have been doing this work in my backyard, and then, you know, the media has been doing a better job, and bilingual media here is really great. And I think that's what we've been working on, because at this point, it's a choice issue. There's going to be enough vaccines available in my community. It's just whether or not people take it, whether or not children, encourage their grandparents to get a vaccine, whether or not, parents like my parents, I would say like last year, my dad might not want to take in the vaccine, even if he had it available. And that sounds terrible, because that means that there's people like that right now that are not choosing to do that and could better protect themselves and their family if they take the vaccine. And I mean, that's a problem. But it's more education and more exposure and more deep. And I still believe that this last year, making COVID-19 a political football and how severe it is has only hurt how we communicate about the urgency about this vaccine and taking it. And we just need to do a better job. I need to keep doing a better job of getting out to the community about this vaccine.
Has your mother or other members of your family also been vaccinated at this point?
My mother has been vaccinated, thankfully. My brother has not been. Nobody else in my family has yet at this time. Just my mother.
So looking, and I know we're a bit over time here, and this will be my last question. It's looking to the future. It seems like we're nearing the end of what has been this just a devastation of this pandemic. There's still ways to go, but the light, people say it's at the end of the tunnel. Biden is hoping that all adults are vaccinated by May. You'll still be serving as a senator in Nebraska. The impacts of this in your personal life and just for so many people are going to continue. What are your priorities going to be, do you think, looking ahead, not just, to the end of this year, but the next years, and then if you serve another term, the 6 years after that as well? Talking about all these inequities, these pre-existing sort of problems that COVID has exposed. What are you going to be most focused on, you think, to serve your community?
The thing is, the things that I was working on before the pandemic started were all had to do with equities. And largely what I'm working on is sort of doubling down on many of these issues, most tied to healthcare and to sort of education and housing, because education and housing and health of a household is so intertwined. Like the statistics of how much you make is so intertwined with the health that you have and the zip code you lived in, that all these things have to be addressed and fought to improve. So since then, in the short term, I've really been trying to work on worker safety in the short term, advocating and trying to put pressure so that plants and other workers are doing a better job, and also getting their people vaccinated. In the long term, I think our infrastructure just needs to improve. We're talking about, my public health departments have been stretched thin across our state. One-time funding does not improve infrastructure. It reactively, it's like, when somebody's in trouble and you give them money to get out of trouble, that's not improving infrastructure. That's putting an extremely expensive Band-Aid on. This type of thing is going to happen again, and could very easily in our lifetime. And should it happen, our infrastructure for public health, for biocontainment response, for medical experts, for epidemiologists, all has to be substantially better. Not perfect, because that's hard, but better. And so I've been pushing on that. We we actually increased our public health funding in our state. I brought a bill for this, and we've increased it by about 30-40%, simply because I've been fighting for it. Not everybody wanted to do it, but I try to communicate to them that if we don't invest in our public health departments, which are supposed to be preventative, the next time around, misconceptions are only misconceptions when we allow them to be and we don't educate the public. We talk about heart disease and we talk about like obesity, but like the reality is public health is about preventative health. If more people understood that the same way that I wash my hands when I go to the bathroom can contaminate food, washing my hands in a pandemic also helps to then reduce the spread and contamination. Going to the doctor when I don't feel well, then something's wrong, and they tell me that there's a cancer, or they tell me that there's a life-threatening disease, and I listen to my doctors. But amidst the pandemic, when public health experts are telling you that there is a problem and this virus will spread and could lead to hospitalizations in its worst cases and can lead to death, but then people don't listen, that is a preventative public health infrastructure issue that can only change with education and facts. If we don't get to a place where we educate those people that don't believe those things over the next several decades, the same thing is going to happen. And so I've been really focusing on public health infrastructure and funding. I've been trying to focus on authority to make sure more people can weigh in and make the best health decisions for communities. Really been trying to better invest in our education system, because I believe that if we have a more educated workforce, then we'll have people getting higher paid jobs. And then hopefully with a more educated workforce, that's also means more people are going to make more data informed decisions, and not make trade-off decisions amidst the pandemic that are going to cost themselves a lot. People made decisions purely based on if they can afford to put food on the table, pay their mortgage or rent, whether or not they can pay for their utilities. That's people made those decisions when they had to and kept working. And the reason I know that is because my parents made that trade-off. If they don't have to make that trade-off, then maybe people would have just stopped working because they realized their health is more important and they have resources to be able to then not work immediately when something like this is happening. So I'm working on all these things, and then I'm also working on like elected officials like myself. We have to be better at being data driven, and we have to be better at changing people's minds through information and through stories. Because the fact that I got off a phone call with a meatpacking plant, and they've all been offered largely vaccines and only 50% of them are accepting the vaccines. I got off the phone with another friend of mine that runs a police department in a major eastern city, and only 60% of the police officers have taken the vaccine, but all of them were given the opportunity. We have a problem. That's a problem. In our nursing facilities and our development to disabled facilities, we still have 60% of the population that said that 40% still didn't accept it when they had the opportunity. We have something that we have to work on. And the only way that I think people will change that belief is not just going to be on the day in the stories, but also going to be when people like myself take responsibility that their voice can be used to address information and provide facts and address the misconceptions and actually the misinformation, not even misconceptions, misinformation being put out there. It is a responsibility of ours. It's my responsibility as well. And I just got reelected, so I only have 4 more years or 3 more years of this responsibility, and then I'm technically done in the state Senate. I can't run again. I have to wait. But it's all our responsibilities as elected officials, and it's all our responsibilities as people. Yeah.
we should run for the National Senate senator. I think it would be could use more individuals like you up there. I want to thank you for your time, for sharing your story with us. We really appreciate it, and it'll be very valuable for this project and for the research that's being done. So thank you, sir.
I appreciate it. Thanks for listening. Thanks for letting me be a part of this project.
Mhm.